Docusil is a medication used to treat occasional constipation. It is often the first method used for preventing and treating this type of constipation. Docusil is a stool softener that works by increasing the amount of water the stool absorbs in the gut, making the stool softer and easier to pass. It is often used when straining to have a bowel movement should be avoided, such as after a heart attack or surgery. Relief is usually seen in 1 to 3 days with this medication. Be sure to check the ingredients on the label, as the manufacturer may have changed them. Also, products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. The daily dosage and optimal timing for taking Docusil should be discussed with a healthcare professional. If you are using the over-the-counter version of Docusil, make sure to carefully read and follow the directions on the product package. If you have any questions, it's best to consult your pharmacist. If your doctor has prescribed this medication, take it as directed. Typically, you would take this medication by mouth, usually at bedtime with a full glass of water or juice, or as directed by your doctor. The dosage will depend on your medical condition, age, and how you respond to the treatment. If you are using the liquid form of Docusil, be sure to measure the dose carefully using a special measuring device or spoon. Do not use a regular household spoon, as it may not give you the correct dose. If you are using the drops, measure the medication with the dropper provided, or use a dose measuring spoon or device to make sure you have the correct dose. To prevent throat irritation and mask a bitter taste, you can mix the syrup, liquid, or drops in 4 to 8 ounces of fruit juice, milk, or infant formula. It's important to only use this medication when needed and not for more than 1 week unless directed by your doctor. Do not increase your dose or take this drug more often or for longer than directed, as it will not improve your condition any faster and may increase your risk of side effects. If your condition does not improve or gets worse, or if you think you may have a serious medical problem, it's crucial to seek medical help right away. Some common side effects of Docusil include stomach pain, diarrhea, cramping, and irritated throat. If these side effects persist or worsen, it is important to consult your doctor or pharmacist. If your doctor has prescribed this medication, it is because they have determined that the benefits outweigh the potential risks. Most people using Docusil do not experience serious side effects, but it is important to seek medical attention if you experience rectal bleeding or signs of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing. It is important to note that this is not a complete list of possible side effects, so if you experience any other unusual effects, it is important to contact your doctor or pharmacist. The best time to take Docusil and the appropriate dosage will be determined by your healthcare provider based on your specific condition. Before using Docusil, it's important to talk to your doctor or pharmacist if you have any allergies or if you are allergic to it. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's essential to discuss this with your pharmacist. If you experience severe abdominal pain, nausea, vomiting, or a sudden change in bowel habits over the previous 2 weeks, it's important to consult your doctor or pharmacist before using this medication. Before undergoing surgery, it's crucial to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to inform your doctor before using this medication. It's also unknown if this medication passes into breast milk, so consulting your doctor before breastfeeding is essential. As always, it's important to follow your doctor's recommendations regarding the daily dosage and optimal timing for taking this medication. When taking Docusil, it's important to be aware of potential drug interactions. It's possible that other medications or herbal products you're using could impact how Docusil works, or increase the risk of serious side effects. To ensure your safety, keep a list of all the products you use and share it with your doctor and pharmacist. This includes both prescription and over-the-counter drugs, as well as any herbal products. Before making any changes to your medication regimen, always consult with your doctor for their approval. It's also worth noting that mineral oil is a product that may interact with Docusil, so be sure to discuss this with your healthcare provider if you are using mineral oil. If you or someone else has taken too much Docusil and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or reach out to your local poison control center at 1-800-222-1222. For Canadian residents, you can contact your provincial poison control center for assistance. It's important to not share this medication with others. Make sure to keep all medical and lab appointments. To prevent constipation, it's recommended to eat dietary fiber, drink enough water, and exercise regularly. Docusil should only be used for temporary relief of constipation. It's important not to take this medication for a long period of time to avoid becoming dependent on laxatives. If you forget to take a dose of Docusil, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at the regular time. Don't take a double dose to make up for the missed one. It is important to store Docusil at room temperature, away from light and moisture, but not in the bathroom. Keep all medications away from children and pets. Do not flush Docusil down the toilet or pour it into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.